Hey guys, just want to alert you to the fact that the federal government has recently made a decision to increase mental health care support to Victorians during the coronavirus. And the way they've implemented this is to increase the amount of sessions you can have with psychologists through Medicare from 10 up to 20. So originally speaking, what would happen is you would go to your GP, get a mental health care plan that would entitle you to 6 sessions with a Medicare rebate with your psychologist. After those 6 sessions, you would go back to your doctor, have a review, and you'd get 4 more sessions. And so that would last the duration of a year. So now they just recently extended that to 20 sessions in a year. So I'm just looking through the announcement on the APS board. So through that GP referral, people in Victoria subjected to further restrictions can now receive up to 20 sessions of psychological care through Medicare. So obviously this is in response to the increased restrictions that we're experiencing in Victoria. I think that also sort of reflects the importance of looking after your own mental health. For those of you who aren't typically familiar with the process, the way, as I said before, the way you get a mental health care plan is through your GP. What they'll do is then either assess you or just write you up on the spot a referral to see a psychologist. Obviously that's probably going to be done through telehealth if you're in Victoria, but irregardless, that basically means that your sessions have a Medicare rebate attached. Some psychologists might add a premium on top of that rebate, and depending on who you see, the rebate actually differs as well. So there's 2 different forms. The codes are 80010 and then there's also 80110. The main difference really is the rebate, but it reflects the level of qualification of the psychologist. So a clinical psychologist will have that 80010 label, and that just means that the rebate in their sessions is higher, but it also means that they're probably going to charge more as well. So at the end of the day, they tend to balance out. The main reason that this announcement is significant though is by doubling the amount of sessions you have in a year, a lot of people will be able to have fairly affordable psychology sessions for the whole year. So if you think about having 20 sessions across a 1 year span, we're looking at more than 1 a month. So if you're thinking 52 weeks in a year, 20 sessions, you're approaching that fortnightly amount, slightly under it. If you are someone who's considering seeing a psychologist or who has stopped seeing a psychologist on the basis of rebate sessions and not having enough, there are now 20 of them in a year. So that would hopefully provide you with more opportunity to go see somebody. Yeah.